Here to talk about what I consider to be the major difference between the obstetric model of delivering babies and the midwifery model of delivering babies. And the advantages to me, both with evidence-based medicine and common sense, are simply overwhelmingly on the side of the midwifery model of delivering babies. But at least you've given them the opportunity to have the information to make the decision or not make the decision. And that's not what's happening. We live in a world where we're supposed to make our decisions on what's called evidence-based medicine. And that is that the evidence shows that this has value. Okay? And then we are supposed to take that information as physicians and we are supposed to give consent to our patients and their families. And it's called informed consent. Okay? And the patient is then supposed to take that information and decide whether to consent or to refuse. And because I'm an obstetrician, I read the website, the American College of Obstetrics and Gynecology website, and throughout their website for their physicians are sentence after sentence about the sanctity of the woman's right of self-determination, that we should never interfere with her ability to choose a procedure or refuse a procedure. But what happens is in modern medicine is that patients are not given true informed consent. What they're given is skewed informed consent. They're given consent in a way that gets the result that the consenter wants them to have. In other words, if somebody wants a vaginal birth after cesarean, but they're only told, well, you could rupture your uterus and your baby could die, then they're going to, obviously no mother's going to choose to have a vaginal birth after cesarean. But that is not all there is. There's so much more that would make a lot of women, even in the face of that knowledge and that risk, choose to have a vaginal birth if they were told the proper information. And the same thing goes with cord clamping. If people were told the pros and cons of cord clamping, there would be very few people that would say, yeah, go ahead and clamp my cord. But it's not something that's ever even consented. It is something that is just routinely done. I have never seen a course taught. I've never seen, and not that I love forms, but because I hate the forms, but a consent form for whether or not to clamp the cord. But it should be something that that's in the birth plan if patients have physicians or midwives that push them into the track where they actually can come up with their own birth plan by doing reading and getting what's called true informed consent and not being skewed to doing what the doctor wants that's expedient. And again, there are midwives too that do this too. So I don't want to keep saying doctors, because there are some doctors who do it exactly the right way. But other doctors do it expediently, other doctors do it because that's the way they're trained, and they've never really given it any open thought. There will be eventually, not that I love the legal system, doctors do, I don't, but sometimes it's going to take a good civil rights attorney to come along and file some sort of class action suit against insurance companies and hospitals that are forcing patients to have a procedure that's unnecessary. And here's the whole irony of the whole thing, the crazy thing. A woman has a vaginal birth, and then say she has a C-section, but now she wants a third vaginal birth. You can't do that. Okay? Another woman who's never had a baby decides that she read that Britney Spears had a primary C-section because she didn't want her vagina to be stretched. Okay? She tells her doctor that, her doctor says, sure, we'll schedule it, no problem. Hospital says, come on in, have an unnecessary surgery. All right? It's absolutely fine. The ironic thing is that they'll welcome with open arms the person who wants an unnecessary procedure. But they'll ban somebody who wants a procedure that actually is successful 80% of the time, and if it's successful, has far less morbidity than an elective repeat cesarean section. But they'll ban those. It's bizarro world, as some of my friends like to talk about. Everything's upside down, and if you're a Superman fan, you know what I'm talking about. It's all backwards. Everything's upside down. How can a hospital, other than money, why do they allow a woman to have an unnecessary surgery? They would never let anyone else have an unnecessary. I want my knee operated on. Well, but you don't have a knee problem. I don't care. I want it anyway. Oh, sure, come on in. They would never let that happen.
Why are they letting it?
I don't know. Well, and that's right. Well, they haven't been given informed consent about the risks to the baby of elective cesarean section. And we can talk about that in a second. But it should be allowed. I think that women should have the choice of having an elective cesarean section. I'm not saying that, my example wasn't to exclude that. My example was to say the absurdity of that they can have the choice of that, but they can't have the choice of vaginal birth, which God intended. Uncomplicated vaginal birth is certainly better for a baby, by far. Okay? I mean, even if you look at things like bonding, if you look at things like the alertness of babies when they're born and when you put them right on the mother's chest, when there's contact immediately and the father has contact immediately. But more importantly, now there's even scientific evidence that, of course, babies born by cesarean section have an increased risk of childhood asthma and lifetime respiratory problems. So to tell that to a woman who wants a VBAC or somebody who wants an elective C-section, and then give them that information as well. That, yeah, if you have an elective C-section, you're right, your vagina may not be stretched out, but your baby will have a slight increased risk of lifetime respiratory problems, including childhood asthma. Would you choose to do that? You know, I want to do what I want to do, but if it doesn't work out the way I want it to, I want to sue that person over there. Okay, that's got to stop. But everybody has the right to self-determination. Okay, and after they have the information, if they choose to go that route of elective cesarean, fine, or repeat cesarean, fine, or C-section for breech or a vaginal breech. Now, granted, people coming out of training are not learning now to do vaginal breeches or forceps, so those skills will die, at least in the United States. Okay, Europe is so far ahead of us in this. I mean, in some things we want to be so much more like Europe, but in healthcare we're not. In healthcare Europe is going away from that model, and they're going back toward the midwifery model. And the C-section rates in places like Belgium and Denmark are unbelievably low. They're 7, 6, 7, 8%. It makes perfect sense, okay, that people start out doing what they know. Okay? And so in residency, if you see only sick people, if you see very few normal births, because the normal births are done off by the midwives on another floor, or the private doctors are doing the normal births, and you as a resident are dealing only with the really odd, sick things, and you're being taught by maternal fetal medicine specialists in an environment with administration, risk management, insurance companies kind of dictating hospital policy, you're going to think that every single patient needs to be treated in a certain way, and that there's no room for individualization of care. But everybody's an individual, and every woman deserves the right to know. Nobody wants their belief system undermined. It's very anxiety-provoking to have something that you believe is your foundation to be undermined, whether it's medicine or your home life or your politics. It doesn't really matter. When you are confronted with somebody with evidence that's contrary to what you've been doing for 10 or 15 or 20 years, okay, it's very hard to believe that, because you have to then look back and say, well, what have I been doing wrong? I've been doing something wrong all this time. It's not about that. And about counseling patients, you gave the example of, well, if this were my wife, I would do something differently. Well, that's not what you should, those of us who know, and most doctors know, shouldn't be using that paternalistic technique for counseling. That's not fair. But what is fair is giving people proper information, or if they don't have the time, and I understand that no doctor has the time for 30, 40 minutes every obstetrical visit to be answering questions. But we have the internet now, and you've got all kinds of websites that you can refer people to. Okay, and they've got brochures that you can get out. And people come in want to be well educated. So there is this conflict between what they're taught and the time constraints and the legal aspects they're thinking, and then what really patients deserve. Unfortunately, and we're getting off the track here, but when insurance companies and stuff like that don't pay well for obstetrical care, you have to do volume and you have to move along. And if you get paid the same to spend 12 hours with a woman in labor or to go in for 45 minutes and do her C-section, and you get paid the same, okay, which one's it going to be? And even your values get corrupted by your economics. It happens to everybody.